when I'm in my car and I'm driving to work, I hear the news and it is consistently telling me, and in fact on the M23, people have painted on the road, stay at home. And I have those moments where I'm like, should I be coming in? Why should I be coming into the office?
Yeah. I think it depends on what you do. So clearly, in order for us all to survive, we still need vital services to happen. So we still need the postman, we still need the shops, the supermarkets to be open, we need the delivery drivers who do the supply chain, we need people to work in the healthcare system, we need people to work in TV and radio stations and journalists to give us the news about what's going on. So the stay-at-home message is a message about reducing the risk for an entire population, but at the same time, there is an element of a new normal life that has to go on.
So, and what we do here, we don't have patients coming in and out of this building. So why is the work that we do still considered so important?
And the healthcare isn't just about the interaction between clinician and the patient in a consulting room somewhere. Goodness, I mean, we're learning now really quickly that we don't even have to do that very much of the time anymore. It's all about an exchange of information, and the people who work in here, our jobs are about connecting with people who've got healthcare needs. Those needs haven't gone away, and the need for people to be able to connect with us and have an exchange of information hasn't gone away. And in fact, if anything, in some respects, the need for that goes up. It's incredibly important that we are still here meeting people's health and well-being needs.
Yeah, and presumably, you know, a lot of what we do, we're going to have to pick up the threads of all of this. At the end of this, we need to keep tracking where people were, where they're supposed to be going. How do we get back to normal after all of this? And that's a lot of some of the work that we do here.
Yeah, so it's about managing the day-to-day here and now, and goodness, you know, that is changing every day incredibly quickly, and at the same time having, you know, an eye on the future about when things get back to something a bit more like how we used to be, that we want to be able to manage and be able to function and help people then as well.
So given that, and we want to make sure that we reduce the risk of infection as much as possible, can you tell me, just really simply, how do people get infected? What is the route that I might catch this? So
coronavirus is a virus that is transmitted by droplets. What does that mean? That means if a person has the virus coughs or sneezes or in other ways generates body fluid and sprays it out, they will spray it either directly onto you if you are standing closer than 2 meters away from them, or, and actually more commonly, onto a surface. You then come along, you touch the surface, the virus is still living on the surface, and then at some stage you touch your face, your mouth, your nose, your eyes, and the virus gets into your body.
Okay, so it can get onto my hands and I'm still not infected, I'm still not at risk. It's only if it's got to get from my skin into my body in some way. So I've got to eat something, put my hands in my mouth, rub my eye.
Yeah.
Okay.
Which is why we keep being told washing your hands is so important. So the 20 seconds of hand washing that removes the virus that you may have encountered on a surface that you touched, and removes it from your hands, so the next time that you do inadvertently touch your face, the virus is no longer on your hands.
Okay. And safe hand washing. So my kids are doing this at school. Have I got this right? Palms of the hands, backs of the hands, in between my fingers, backs of my fingers, fingertips, thumbs, and back of the wrist.
Perfect.
Ah, I've got it. Fantastic. Okay, so then when we're here at 11177, what are we doing here to make sure that we're okay?
So I'm struck by actually what a safe environment this is. We're really very lucky that we've been able to have workstations that are 2 meters apart. We have all been mindful, I think, about when we have meetings with people that we are, as we are now,
and 2 meters, I need to not be able to touch your hand, right?
That's correct.
Okay, so we're definitely 2 meters.
Yeah. Or if you imagine Stephen Merchant, the comedian, who's 2 meters tall, it's Stephen Merchant length away.
Distance apart.
But
even with that, if I come closer than 2 meters to you, I'd have to do that for more than 5 minutes before I'm really out.
In fact, technically, it's more than 15 minutes.
Okay.
And really, it's only if you cough or sneeze over me.
Okay. So the 2 meters is a kind of belt and braces anyway.
Yeah.
So if you're coughing, I definitely want to be at least 2 meters away.
Yeah.
And then it's just about managing these touch points that you said. So if there's a droplet somewhere, making sure I'm not picking it up, or I'm washing my hands if I.
And let's not forget, people who do have a cough or a cold, self-alive, they're not coming into work anyway.
Yeah.
And then we've got even more belt and braces because we've now got somebody downstairs outside the breast clinic who will take your temperature for you and check before you come into the office as well.
I love that. So much more accurate than my thermometer at home.
Yeah, yeah.